ADNI is a really terrific project. It's been funded by a lot of NIH agencies and also by private industry. And it basically tries to understand what are the best predictors of Alzheimer's disease, what are the best measures of Alzheimer's disease spreading. So if you had a blockbuster Alzheimer's drug, you'd need to have some evidence that it was working. So ADNI tries to find the best way of imaging the brain. Is it metabolism, is it activity, is it physical structure? And so basically, ADNI is following 800 people. They get scans, spinal taps occasionally, and genomic data collected. And a lot of the questions are, which are the good predictors of brain decline? Which are good measures of whether medications are working? This project's been going for quite a while now, and it's discovered a lot of important markers that tell you whether you're getting better or whether the medications are working. A lot of the work that ADNI is allowing us to do is build methods that we're going to be using in drug trials. And so one thing that's sort of interesting is that not all the interventions for Alzheimer's disease are drugs. And so there's cardiovascular interventions, there's lifestyle interventions. And some people think, well, just because it's not a drug or a medication, it couldn't be effective. But we know that there's some dietary interventions that are helpful for aging. There's also fitness and exercise programs. It's very important to know which things are best. So we have a lot of studies of cardiovascular health in the brain, and some of them are very promising. And so we know that if you can walk a little bit every day, I mean, elderly people can certainly walk, they might not want to get up and get around much more than that, but it really truly saves brain tissue. So often they can be important even before the drugs come to the market. Some dietary interventions, people taking vitamin B supplements. We have drug trials that show, not just us, but other people, that show that there's some evidence that supplements are useful for the brain. So if you think of a sort of very broad range of things that people could do, imaging is often useful to test whether it's effective, and even if it's only moderately effective, it can often be very practically useful.
Alzheimer's disease is the most common form of dementia, and in people with Alzheimer's, there is actual nerve cell death, and it's an organic brain disease. That's one of the things we really try to point out. It's not a mental illness, it really is an organic brain disease. When you look inside the brain, there are the hallmarks of what's called plaques and tangles that occur in the brain. So all of those symptoms that we see in people with Alzheimer's, the memory loss, the confusion of time and place, the inability to make good decisions, is because there is nerve damage actually in those parts of the brain.
Alzheimer's disease is an illness that we now understand on a molecular level. So we understand the molecules that are involved in the death of brain cells. So it's a disease that involves the slow, gradual death of brain cells in particular areas of the brain. Under the microscope at autopsy, it's associated with the aggregation of two different proteins. One is a protein called beta amyloid, which is a fragment of a very normal protein that's present in everybody's brain. And the other protein is called tau. It's another protein that's a perfectly normal protein that's in everybody's brain. But for whatever reason, these two proteins independently become aggregated together. When beta amyloid aggregates with itself, it forms what are called plaques in the brain. And when tau aggregates with itself, it causes what are called tangles in the brain. And this is what a neuropathologist looks at under the microscope at an autopsy specimen. And what it is for a patient is a gradual loss of intellectual function that usually, not in all cases, but usually starts with loss of short-term memory, loss of the ability to form new memories. Patients lose the ability to solve problems, to think logically. They lose the ability to navigate, to be able to find their way around a neighborhood, for instance, that they previously knew how to find their way around. They lose language abilities. They lose the ability to think of that precise word that they mean to say that expresses what they're trying to express. And so in the end, it affects all aspects of a person's higher intelligence, the ability to communicate, to navigate, to solve problems, to function independently.